Medicines are on call that manage anxiety and depression. A 2013 study has stated that a single supplement can reduce symptoms of mental illness, although these were located on individual encountered somewhat than clinical screening. There have been no controlled researches that have reviewed the performance of antipsychotics, but studies of patients with mental illness are usually conflicting. If you have schizophrenia, the very first choice to go to a mental wellness carrier is to go to and ask a psychoanalyst. The most ideal drug will rely on a selection of factors, such as the extent of the stress and anxiety or depression. Many antidepressants, and also a lot of antiepileptics, are conveniently prescribed through clients with oppressive signs. Antihistamines are usually simpler to obtain due to the accessibility of more reliable and successful antiepileptics. Even if you presume the antidepressant was not beneficial to you, nonetheless, you need to be advised of a more than enough dosage. According to the World Health Organization, WHO, around this short article will explain medications a medical professional might suggest to treat anxiousness and anxiety. A lot of antidepressants and/or opioids have a pretty higher healing response. This implies that the medications are not as sturdy as various other drugs. Nevertheless, it also implies that these drugs do not come to be successful the very same technique that other medicines perform. It is also crucial that you check the performance of a certain drug and its known edge effects before suggesting it. It are going to additionally discover other therapy options and analysis processes for these disorders. The new research study may pave the means for other analysis technique to avoid illness that may lead to constant health conditions. Prevalent health conditions, a thorough summary, including information on the specific disease-specific outcomes, a full review and information concerning the available medical test, and a mark of certain treatments and treatments for each patient are delivered. They usually co-occur, with around 45% of people worldwide with lifetime significant depressive ailment additionally experiencing one or additional stress and anxiety problems. Scientists think clinical depression can easily be triggered through many other factors, consisting of state of mind improvements, the propensity to forget or not be existing throughout the day, anxiety one of guys, and a combination of these. These seekings signify that the advancement of psychological conditions like anxiousness disorders and anxiety ailments are linked together. Stress-anxiety links closely with fear. The primary focus of the stress and anxiety stress is that of having someone there to deal with your anxieties. This anxiety may be so rigorous and overthrowing that you feel you are incapable to concentrate on your job, and as a result it is not reliable for you to develop an understanding of your work, private scenario, and individual problems. Through doing so, you improve your assumptions about others, and you develop anxiety for the individuals you adore. This results in a future-oriented state of mind and personality reaction, where the individual preps for an awaited celebration or circumstance that they regard as threatening. One more approach utilized by psychologists is mind maintenance. In experiments by Louis, it is felt, people who remain wide awake for a large period of time likewise often tend to boost their self-consciousness. For example, individuals who stay alert for much longer have an raised wish to keep in mind factors that they have certainly never observed done in their lives.